I would like to thank the organizing committee for the opportunity to present my work at the SID meeting. I'm Martin Alphonse, and my presentation is about using pan-caspase inhibition as a novel immunotherapeutic against methicillin-resistant Staphylococcus aureus, or MRSA skin infections in mice. I have no conflict of interest. Staphylococcus aureus, a commensal of the human skin and hairs, is also an invasive pathogen causing skin and soft tissue infections. Combined with increasing antibiotic resistance, Staph aureus infections can be deadly. And when not fatal, it results in a seeding of abscess lesions in nearly all organs, including the skin. The graph shows the increasing antibiotic resistance of MRSA over time, and with reduced development of novel antibiotics, there is an unmet clinical need for developing non-antibiotic immunotherapies to combat MRSA. In the process of identifying novel host-mediated therapies, understanding the host immune response to MRSA becomes imperative. As an immune-evasive mechanism, Staph aureus induces apoptosis in immune cells, including macrophages and monocytes. However, to counter the infection, the host mounts an inflammatory response, predominantly orchestrated by neutrophils and the cytokine IL-1 beta, which are necessary in the clearance of the bacterial infection. In the process of secretion of active IL-1 beta cytokine, the cells activate inflammasomes. Inflammasomes are multi-protein complexes that are assembled upon detection of pathogen or damage-associated signals. Nod-like receptors, NLRs, ASC, and caspases, including caspases 1, 11, and or 8, can combine together to form the inflammasome complex, which can be detected by ASC spec formation. And once activated and cleaved, the active caspases are important effectors in secretion of the cytokine IL-1 beta. Either bacterial-induced apoptosis or host-mounted inflammatory response, caspases are critical proteases in initiating and executing programmed cell death and secretion of inflammatory cytokines such as IL-1 beta. A small molecule ketone, Q-VD-OPH, is a pan-caspase inhibitor. With having a broad spectrum, it can irreversibly inhibit various caspases. And Q-VD-OPH has been used to inhibit viral infections such as SIV and HCV by inhibiting apoptotic signals. Therefore, we use this pan-caspase inhibitor to study its effect in bacterial skin infections. Black 6 mice, backs were shaved, and a community-acquired USA 300 bioluminescent MRSA strain was injected intradermally. After 4 hours post-injection, the inhibitor was injected intraperitoneally, and mice were imaged for bioluminescence for the bacterial load, and digital photographs were taken to measure the skin lesions over a time course of 14 days. Panel A shows representative photographs of wild-type untreated mice versus Q-VD-OPH treated mice, and panel B shows representative bioluminescent or BLI images of wild-type and Q-VD treated mice over the time course. Panel C and D shows the mean lesion size and BLI over time of the untreated and treated mice respectively, and panel E represents the ex vivo colony-forming units of bacterial burden of the untreated and Q-VD treated mice on day 3 post-infection. Clearly and dramatically, Q-VD-OPH treated mice showed decreased bacterial burden and reduced skin lesions when compared to the untreated mice. We further studied the effect of the inhibitor in yet another gram-positive bacteria, Streptococcus pyogenes. Similar to MRSA, Strep pyogenes was cleared effectively with decreased bacterial burden and reduced skin lesions with Q-VD-OPH treatment. We further studied the effect of Q-VD-OPH in a gram-negative bacteria, Pseudomonas aeruginosa. Interestingly, though not early, there was decreased bacterial burden and skin lesions with the inhibitor-treated mice. Furthermore, 100% of the mice treated with the inhibitor survived when compared to 60% survival rate in the untreated mice. Using MRSA skin infection as a model, we pursued to understand the mechanism of action of Q-VD-OPH. with IL-1 beta being a critical cytokine in the clearance of Staph aureus, and given the involvement of caspases in the processing of IL-1 beta secretion, we investigated the role of IL-1 beta pathway in Q-VD-OPH treated mice. And when Q-VD-OPH was treated in mice lacking IL-1 beta, we were still able to observe the therapeutic effects of the inhibitor, suggesting that the effect was independent of the cytokine IL-1 beta. So, okay, it's not IL-1 beta. So what happens to inflammasome formation, where caspases are essential components? Does Q-VD-OPH inhibit the formation of inflammasome itself? Was a burning question we wanted to understand. And to detect inflammasome assembly, we measured ASA spec formation. And to do that, we used the ASA citrine mice, where ASA is ectopically expressed with citrine, which can be detected by fluorescence upon ASA spec formation. The mice were injected with Staph aureus with or without the inhibitor, and the ASA citrine fluorescence was measured at 6 hours post-inhibitor treatment on whole mice using IVIS imaging, and at 24 hours, the same mice were sacrificed and ASA citrine expression and ASA spec formation was measured in immune cells using pulse shift assay by flow. Panel A and B show no difference in the BLI or bacterial burden between the inhibitor treated or the untreated mice. However, when we measured ASA citrine fluorescence, the Q-VD-OPH treated mice showed complete inhibition of ASA spec formation, as shown in panel C and D. Again, at 24 hours, in immune cells, there was no difference in the expression levels of ASA citrine between the untreated and the inhibitor treated group, as shown in panel E and F. However, there was inhibition of ASA spec formation in the inhibitor treated group at 24 hours in immune cells, suggesting that Q-VD-OPH inhibits inflammasome assembly. And when mice that lacked caspase 1 or 11, or both 1 and 11, were treated with the inhibitor, the therapeutic effect was unaltered in the mice, suggesting that inflammatory caspases and inflammasome activation was dispensable for Q-VD-OPH efficacy. Therefore, in the process of identifying the specific role of inflammatory caspases in the therapeutic effect of Q-VD-OPH, we inhibited caspase 1 and 8 with specific inhibitors of similar compounds in nature in a caspase-11 knockout mice. So essentially, when we inhibited the inflammatory caspases 1, 11 along with caspase 8, interestingly, we observed similar therapeutic effect as we observed with Q-VD-OPH. Now, given the caspase 8 involvement, we specifically asked the role of caspase 8 mediated apoptosis. Also, is there a difference in immune cell population or composition? And if not IL-1 beta, what could be other possible cytokines that may be involved in the clearance of bacterial infections? These were some of the questions we pursued in an effort to understand the immune landscape with the Q-VD-OPH treatment. Again, by specifically designing a flow panel, we immunophenotyped cells with staining for active caspase 8 and determined the cytokine signature at day 1 with or without the inhibitor treatment. There was increased monocytes and macrophages, and we observed no difference in neutrophil numbers with the inhibitor treated mice when compared to the untreated group. Indeed, Q-VD-OPH inhibited caspase 8 mediated apoptosis, especially in monocytes and neutrophils. At the same time, there was increased expression of TNF in immune cells. Cells, including monocytes, macrophages, and neutrophils, expressed increased amounts of TNF with the inhibitor-treated group. Furthermore, the secreted levels of TNF in the serum of the mice were also increased with the treatment of the inhibitor, suggesting a possible role for TNF cytokine. So we treated mice that lacked TNF or TNF IL-1 receptor with the inhibitor. And interestingly, there was no therapeutic effect of Q-VD-OPH, especially in the bacterial clearance of Staph aureus in mice that lacked TNF, as shown in panel G and K. And to further confirm our results, we treated wild-type mice with anti-TNF antibodies and observed similar results, where the inhibitor Q-VD-OPH did not have a therapeutic effect for the bacterial clearance, suggesting that TNF is necessary for the host response for bacterial clearance when the mice were treated with Q-VD-OPH. In summary, Pan-caspase inhibition decreases the bacterial burden and reduces skin lesions for both gram-positive and gram-negative bacteria. And by treating with Q-VD-OPH, we are inhibiting the inflammasome activation and IL-1 beta pathway, thereby altering the host immune response to mount a TNF-dependent bacterial clearance. And furthermore, the inhibitor treatment inhibits caspase 8 mediated apoptosis and increases monocytes and macrophage population at the site of infection, possibly aiding in the clearance of the infection. Taken together, our data show that pan-caspase inhibition is a novel immunotherapeutic against bacterial skin infections in mice and especially opens up a possible host-mediated immunotherapeutic option against antibiotic-resistant MRSA skin infections. With that, I would like to thank Lloyd and Nate and acknowledge members of the Archer Lab, especially Dustin, Yulia, Nick, Aman, and Jessica for their assistance with this project. I thank the NIH funding agency for making this work possible, and our lab is supported by industries such as Pfizer and BI for various other projects in our lab. Thank you.